This other lady comes up, she's got bitches about the mental health authority and about the treasurer. I was like, I believe so, because he was saying how they had 10,000 properties as part of the discussion today. Oh, yeah. Yeah. It's going to be an interesting discussion when that comes up in a few months for being re-up. We're ready to go? All right. I'm leaving. Oh, no, I mean, we got to do this. Yeah, we got to do this, don't we? We are calling the Health and Human Services Committee of the Wayne County Commission to order. Mr. Clerk, what's up?
Roll call. Commissioner Marecki is excused.
Yes, Commissioner Marecki is excused.
Commissioner Dahl.
Here.
Commissioner Anderson.
Here.
Commissioner Baker McCormick.
Here.
Commissioner Killeen.
Right here.
Chairman, you have a quorum present.
Thank you. Next.
Next item B, approval of the May 21st, 2019 meeting minutes.
Pleasure of the committee.
Support.
Any additions, changes, corrections to the minutes? Hearing none, all in favor, please say aye.
Aye.
Aye. Opposed? Abstentions? Okay. A Head Start contract. What do we got next, Mr. Clerk?
Next item C, unfinished business. There is none, Chairman. Next item D1 under new business, approval of modification number 8 to a contract with a 1-year option to renew with the Children's Center of Wayne County.
Okay, let's hear from the department on this, how this is the absolute last closeout for Head Start, Part 14. Good morning, name and titles for the record.
Brian Manning, Deputy Director.
Kamal Keparu, Management and Budget Finance Director.
Okay. And?
Mr. Chairman, this is the last Head Start contract.
We worked this out ahead of time.
There's spreadsheets and logs and all kinds of stuff on why this kind of went back and forth from commission internally, back and forth with Head Start region, but this refers to the closeout process, not for the grant we just left. This is the grant that we were kind of the superintending agency for the 5 delegate agencies. This is part of the scope of work from the city of Detroit for the 48219 zip code that was subsequently recompeted and I believe granted by the Head Start region to Matrix. But this relates to the closeout activities for the old grant, which involves financial accounting closeouts, administrative closeouts, disposition of records, etc. That goes on.
This was the grant that the feds gave us?
Yes, the original.
The original
it was part
one.
of the original $20-some million. Original.
For us to kind of do oversight and management?
Yeah. And
Of all the Head Starts that we had around.
And we were, an administrator and fiscal agent for, a number of nonprofit organizations that did this work on behalf of the county. So, and this is, I'm looking at Mr. Keparu, I believe this is the final agreement that we anticipate from Head Start Region 5 for any of the county's various grants that we've received in the last several years.
I'll go with what he said. Yes, this should be the last contract, just reconciling and just closing this out. I expect this to be the last, but again, we still haven't got final say from the region. But if the region end up contacting us, we may have to do something. But as far as contracting, this should be it.
So we have to come up with an additional 51,000?
No, we didn't have to come up with it. It was just we had to we already received it by way of a NOAA, but we never put it in a contract. So we had to match up the NOAA with the contract. We went back and forth with the Children's Center and our own internal working. So it was extra money from a NOAA, but it just wasn't reflected in the contracting process.
NOAA.
Oh, notice of award.
So we got an additional 51,000 under that grant.
Correct.
Okay. All right. Questions from committee members on this?
Support.
Okay. And the retroactivity, you spoke to a little bit, Mr. Manning. What was the deal there?
Will only characterize it, Mr. Chairman, as the typical things that happened with Head Start. Usually these were coming in late in origin from the region, and then these got batted back and forth, kind of, you know, for the various kinds of problems of accounting and processing, et cetera, which sort of underscores what I'll call the thematic difficulties of managing a Head Start project.
But that's because they were giving us money. If they wanted 51,000 from us,
Right.
that would be a different
It'd be a
story.
very streamlined process by which to do that, I'm sure.
Any other questions
Yes.
on this item? We have a proper motion and support. All in favor of the motion, please say aye.
Aye.
Aye. Opposed? Any abstentions? Thank you, gentlemen. Mr. Clerk?
Next item 2, approval of contract modification number 27 to a contract with 3 one-year options to renew with the Black Family Development, Inc.
Okay, this is another quarter has gone by, and with our CMOs, we're settling up for the quarter based on encounter data, and some pluses for some CMOs, some minuses for other, based on encounter data,
Mr.
correct?
Chair.
Commissioner Anderson.
I think we have, 4 of these?
5.
Or 5? Can we take them all in one motion?
Certainly can. This is,
I'll make that motion.
okay, for approval, I assume?
Yes.
Okay, so that's D2 and is supported. D3 with Bridgeway, D4 with the Center of Use Family, Growth Works, and then D6 with Star Vista. Any comments from administration on this? Anything unusual, earth-shaking?
Cecily Hoagland, Administrator in the Juvenile Youth Service Division in HBCW. There's nothing unusual about the adjustments. This is the second quarter adjustments for the CMOs. It's based on days of care within that quarter.
Okay. Where are we at with CMO contracts? Are they up for,
They'll be up September, they expire September 30th, 2020.
so there's still another year to go on these? Okay. Just so that we're all know where we are in the stream on this.
And
Questions from committee members on these items? Commissioner Anderson.
Well, to that point that you asked about, I think Brian was getting ready, hopefully, to answer it, but where are we at with the process as far as the current providers and everything?
so, Commissioner Anderson, we're kind of going through we're also going through the memorandum of understanding update with the Third Circuit right now. So there's a little bit of strategic discussion with Executive Court Administration and Chief Judge Kenny kind of on, I don't know, the periodic refinements that any kind of system of care rightly, should consider, and how those might work their way into a solicitation. So you probably see the MOU first have come to this body probably over the summer. The calendar interpretation of summer being September 21st. So hopefully it's here, August, early September at the latest. The solicitation out this fall, probably. This is a big solicitation, both financially and kind of in program importance. So we'll be kind of talking with stakeholders internally and building out a scope, and we'll also hopefully just have real firm, clear expectations from the state kind of on how they want to see this work as well. So that's mid-fall.
Okay.
Yeah.
trying to get some idea of what we should expect.
It's a high-value solicitation. They were going to probably line up a pretty, I'll call hefty, review panel, from the county to consider the bid. So we just need enough lead time to get kind of the key people able to read the proposals and then participate in the various meetings to, so.
Good, thank you.
Is this a new MOU with Third Circuit, or do we have something existing that's like it?
Yeah, we operate the system of care under their delegated authority, and every 3 years-ish, we re-up that agreement. We had a fairly major rewrite in 16. This, Cecily disagrees. I think this one's more micro in character, just a few tweaks here and there. So I don't expect a major change from this version from the last.
Well, I think we'll take our time when that new MOU comes, I think, because I'm not sure if everybody is aware how much we're doing with Third Circuit and what we're spending over there and what kind of programs that the court is interacting with these young people on. So let's take our time and maybe even, I hate to say, PowerPoint our way through what's in those MOUs and their effect. Other questions on these 5 items, D1 through D2 through D6? We do have a motion. It's been properly supported. All in favor of the motion, please say aye.
Aye.
Aye. Opposed? Any abstentions? Okay, thank you very much. Mr. Clerk, what's next?
Next item 7, approval of amendment number 11 to a 3-year grant award with the Senior Alliance.
Name and title, please, and what are you bringing before us today?
Jones Varakis, Division Director of Senior Services. I am bringing an amendment to the current award from the Senior Alliance for congregate home delivered and liquid meals, and we are accepting an additional $46,684.
So it's going to be both Meals on Wheels and congregate, right?
The $46,000 is actually being put into the home delivered meal program
Okay.
to meet the need. The need
Well, that's
for
right.
home
We're-
delivered is much higher than for
The
congregate.
congregate, so we're pulling a little money out of congregate
Correct.
to pay for the, is for some reason we're not saying Meals on Wheels anymore, or is that a term that's gone by the wayside?
Well, Meals on Wheels mostly refers to the home delivered meal program.
Right?
So when we say the program Meals on Wheels, well, you kind of leave out the halal, congregate, and liquid clients when you just refer to Meals on
I
Wheels.
see. Okay,
So
so we know what
That's
you're referring to when
clarification.
you use these terms of art. Questions from committee members on this item?
I'll move to approve.
I'll support.
Okay, we do have a motion. Where are we at with a waiting list?
I am pleased to report there is no waiting list for any of the meals programs.
But we are putting a little more money in there because a few more people have come on.
Most definitely, yes.
How many additional folks have come on that we need to cover?
Well, we are.
Just to kind of track this and see what's going
Right.
on out there.
We're currently serving about 2,300 home-delivered meals per day. As of right now, about 500 congregate, 600 liquid. So it's keeps us busy, to say the least.
Where were you at a couple of years
A
ago?
couple of
with
years ago, we were
Home delivered.
somewhere in the neighborhood of 1,800.
Okay.
So now we're up to 23,
Wow.
Yeah.
and it grows every day. So,
Okay.
but the fact that we have no wait list is just an amazing.
But we're anticipating maybe by the end of the fiscal year, we'd have to move a few more dollars in there. to
It's
keep the list at
possible.
zero.
It's possible, and I would hope or anticipate that we will also receive more dollars overall
State.
from the state or the federal for the meals.
Commissioner Baker McCormick?
I just wanted to clarify that includes Detroit.
No, ma'am. This
Oh, it does
this serves the
Okay.
county, the 34 communities outside the city of
I
Detroit.
see. Do we have numbers for Detroit?
I don't have them.
okay.
Yeah.
Thank you.
Yeah, that would be DAAA, because that's also, these are regions, 1A and 1B.
Area Agency on Aging.
Area agencies on aging, we have 1A and 1B in Wayne County.
We have 1A in Detroit. 1B is the Oakland County, Livingston, Washtenaw, and then 1C is,
Oh, the Senior Alliance.
the Senior
is 1C.
Alliance is 1C.
That's another way it's referred to. DAAA covers Region 1A.
Correct.
Okay.
Okay, and we can always, Commissioner, have somebody drop by from DAAA to bring us up to date on that as well.
That would be nice.
But their funding for the home delivered and the other meals comes through the city of Detroit, not through the county. So that's why we don't see them,
Here.
even though, yeah. Questions, Commissioner Anderson?
It's not a question, I just wanted to commend Joan for what she does. I had an instance that someone brought, my sister-in-law brought it to, she always tells my wife, and then my wife tells me, and about a elderly lady that was in need of getting nutrition. She was actually told at the local level that there was a waiting list. And I said, no, there's not a waiting list anymore unless something's changed, very short time frame that something has changed. But so I got in touch with Joan, and she took care of it and got the delivery started. Turned out there's other issues now that we're also trying to work. She's trying to help her. I think she has some issues, and she's trying to. She's got someone that we're going to get in touch with elder abuse, because we're thinking the person that's supposed to be her caretaker and overseer is doing some things that keeping her from access to her resources, her money, and things like that. And at least we want somebody to check into it. But I wanted to thank you and call you out for doing the great job that you do and trying to take care of our elderly.
And thank you, Commissioner. Our pleasure to serve. And what we're finding, first of all, is so many more seniors are waiting before they call for service. We currently serve 12 people over the age of 100.
Wow.
Meals on Wheels. They're waiting into their 90s. I think I need a little help. Well, yeah, I think you do. Mm-hmm. And then we're finding that the meal program, the volunteer delivering the meal, making sure the senior comes to the door, it just makes such a difference. It's so much more than the meal itself, as far as the benefit to the senior and contact and safety net issues.
One question, how do our meals compare to what Oakland County gets delivered in that? Are they up to the same quality standards? And I know they're safe, but as far as the appeal and things like that, is there anything that we need to do?
All meals have to meet a minimum standard set by the state of Michigan. So all of the meals throughout the state have to comply to these standards. I do know in Oakland County, though, they have like 12 different providers of their meals. We are fortunate, and the same with the city of Detroit, we have one vendor. So every site and every client gets the same meal. I know in Oakland County, it's quite a bit different. So I would imagine that there would be a variance in not only the quality of the meal, but the type of the meal, the composition of the meal. When you have 12 different providers, that would be a little bit more difficult to oversee, I would think.
Yeah.
No, thank you.
Right. Yeah, I just wondered if we're able to, do an assessment periodically to see that everything is as good as we can afford to provide, and that looks as appealing as possible. I know it's limited and it's tough to do that
Right.
because they have to be packed by and I think probably all volunteers packing them.
Yes.
Even, and delivering them, but it's certainly something that provides that needed nutrition, and as you said, a really important thing. I think we sometimes underestimate the value of the contact with somebody. But thank you again.
Thank you.
And I would encourage everybody in the room to volunteer a little bit on the Meals for Wheels if you can, because absolutely that's maybe the only person they'll see all week to have a discussion with. And so if you want to talk about Hummel figurines or some collections like that are crowded in the living room, but also it is the human connection. And we're going to probably see more people over 100 as the population, you know. So a lot of these folks have outlived everybody in their life. And so having a friendly face come to their door is extraordinarily important for health and other. Other questions on this item? We have a motion. We have a second. All in favor, please say aye. Aye. Opposed? Abstentions? Thank you, Joan.
Thank you,
Good to see you.
Commissioners.
Mr. Clerk, what's next?
Item 9, item 8, discussion on the impact of budget adjustments.
Yeah. It's been a couple of committees since we've done this, and we'll probably, now I'm checking with staff on numbers, right, how many we got after a couple of meetings, and don't want it to get to 25, but don't want to do it at every meeting anyway. So what we'll do is we'll go through the packet one by one. Immediately, the first one caught my attention because I don't believe it's come through here yet. $414,000 grant for lead abatement programs. That went through Ways and Means. I don't believe it's come through our committee yet. Fiscal staff, no.
What number is it? 1935.
This is the first one. Oh, I'm sorry, yeah. You guys talk in that language.
35-151. The first one. It should be the first one in your packet.
I don't think they have the packet like we have. Here comes Mr. Capru. Well, does he have our packet?
No, I got just the original.
Yeah, but let him use that packet because we're going to go through it in a particular order, and then I don't want you to have to shuffle every time. We'll go through it in the order. So yes, this one, $414,530 into the county health fund for, I assume it's lead abatement.
Yeah, just to get a HUD lead abatement grant. Just reconciling the grant, but you haven't exhausted the bid right here.
Right, this isn't.
Well, the first thing I'll ask you
Right,
is this going to come to our committee for approval? If it is, we can discuss it then.
No, Carol Osterberry, Health Officer, this isn't new money. This is just the reconciling of that budget. Yeah, we have not gotten a new HUD grant, is what I'm trying to let you
Yeah.
say.
But
Right? No.
Through the chair, I think what you're asking, it went through Ways and Means. You're talking about if something's going to come to
Yeah.
this committee as far as a contract?
Right, no, it hasn't, there's nothing's
so
changed.
this is a
This is not-
reconciliation?
Yes, meaning reconciling the money.
Okay. I didn't hear a period there.
Oh, no, I was looking at your face waiting. I thought you had a question.
Continue. I probably will, but
This is more money for the grant, right? And so when I mean reconcile, matching what we got, matter of fact, I take a step back. You know, when we set the budget at the beginning of the year, we usually put estimates in.
right.
But once we officially get the grant, if the grant come in higher or lower, we adjust the system to match.
So we actually got a check from the feds for $400,000 more than we anticipated in the budget.
I would just correct check. Yeah, it wouldn't be a check. You know, it's electronic stuff. Yeah. And this is a reimbursable grant, if I remember also.
Right, that's correct. Every month.
We got to send in a reimbursement.
In our, to
Yeah.
HUD through their quote-unquote lock system.
So what did we put in the original budget as what we thought the grant would be? That's how it went into the budget, right? We think we're going to get this grant for this amount.
Correct. We may put in 2.6 million and end up getting 2.8 or something to that degree. It all
A
depends.
lot of money.
And we didn't expect it a couple of years ago. Then we had to adjust it.
I mean, this is all part of the 3-year grant that we got in, here, this is 2019. So we started it last year, and it's just how that money comes back through to us. I mean, it's nothing new. We got the award, and then this is them reconciling as we submit our monthly locks vouchers, is how I understand it. I think it's,
Does this mean we're going to be able to serve more people?
no,
Than we
no.
anticipated?
As I've said, at other meetings, we will be doing lead abatement work in approximately 200 homes.
Right.
We do the inspections in about 250. All of that is the same.
And this money is going to pay the contractors that goes out to do the inspection or whatever they do.
And this is for outside of Detroit, Wayne County. The city of Detroit has their own money for
That is correct.
in there. Okay. Geographically, with these homes, spread out all over the county? I know there's some communities that
Right,
were
a
built
home-
more in the 40s and 50s that might have.
Correct. A home has to be built before 1978, and also low income, and a child under the age of 6 needs to be residing or visiting that home. So, I mean, like you say, there are communities where there are homes that don't qualify just because they were built after 1978.
Do you have like a map with little dots on it to show where all the homes are that we serviced in the county?
Not on me,
I
certainly
know
we can
you,
get,
I
yeah.
didn't expect, but you do.
I mean, we track every property. I can, since this has started, we can get something like that. Sure.
I think, and I don't know how my fellow commissioners feel about this, but I'd kind of like to see where those homes are and who we're servicing, just to have some idea out there. I know it's really bad in Hamtramck and in Highland Park, but also communities like Westland and Wayne that were built with GI Bill, GI Bill mortgages and whatnot. And I know there's a lot of homes out that way, maybe Romulus, but it'd be interesting. And then, of course, River Rouge, Trenton, old communities like that. So it'd be interesting if you have some sort of a summary report.
Yep.
This is how many people, this is where they were served. I think it's always good to have an overall picture of what the reach is of the county out there with the dollars we have.
Absolutely.
Okay. So this is this whole thing is just a discussion item. Are there any other questions on that 414,000, the first one? Anybody? Okay, if we flip over a page, 20,000, and that was the budget adjustment on that comprehensive CPBC, that big grant we get every year from the state of Michigan to run programs in the county on their behalf. They pay us, and then there's amendments throughout the year. So this was one of the amendments.
Correct, dealing directly with emergency preparedness in particular.
Yeah. Okay. If we flip a page, there's a $500. I'd really like to know how much money we're spending keeping track of $500. That's not even a rounding error. Whatever less than a rounding error is, $500 is that. Commissioners, the next one is $1,755. Also, the Emergency Preparedness Program. Okay, any other? Just watching the money flow. The next one is $2,000. Man, and you do this in every department across the county. Wow.
Not the county, but yeah, in our department.
Yeah, but other departments are doing the same
doing
thing
something
with their
similar.
budget. Yeah, not you, because you're in this department, but all departments are doing this. That's a lot of people hour. Just saying. So there's that $2,000. We flip the page, $1,000 in the nutrition fund, a little reallocation there. Paul needs something. Hey, Peter, what do you got? There's a $5,000 item, which is next. Yeah, and it's stuff like materials and supplies where we have to move a couple of bucks. Well, now we're talking real money, $342,000. For the other health programs within the county health fund, serves to certify additional revenue awarded through the Health Resources Service Administration. This is our FQHC. I assume that's the Hamtramck one. And I don't know. I can't remember. Did that come? Yeah.
It's the 342,000. Sorry.
Hey, who are you?
Mary Carr, Senior Fiscal Analyst. The 342,000 is for both the Wayne and the Hamtramck FQHCs, and the contract probably has already come through the committee since this was
I don't
from
think
May.
we've seen this one either. As a committee, it came through Ways and Means.
Right, but the contract was being processed concurrently, so we would have probably seen it within that time frame that we did this budget adjustment back in May.
Did it come through our committee? Yeah. Okay. Okay. More money for FQHCs. Kind of sort of real money, $104,000. Decertifying revenue. In one place for a deficit in community corrections. Is that the deficit elimination ordinance that we have on our books?
Correct.
Yeah. The Ways and Means, what, quarterly? It's the budget reports, and then there has to be an adjustment to those to keep the budget balanced.
No,
on
this is
track?
the bigger one that Kevin speak to, where we have to send to the state.
Right.
So this is one of our business units that's part of the bigger report that Kevin sent to the state.
Okay. But per the deficit elimination.
Correct.
Okay. Got to follow up on that and see how that's doing. Sounds like the Commission CFO would like to comment.
Just to clarify, Mr. Chair, this is based on the most recent CAFR. Any fund that has a deficit, the state of Michigan needs to be supplied a deficit elimination plan. So all they're doing.
It's not our ordinance, it's
It's a state requirement. So this is to satisfy that deficit elimination plan, and it's really just moving money that the general fund was going to be sending to jail medical, and instead of going to jail medical, it's going to community corrections.
Okay.
So we're just moving it instead of to one fund to another to satisfy the deficit
It's a
elimination.
good reminder for me, though, to catch up with you on the county deficit elimination ordinance.
Well,
Not going to do that here.
Yeah.
But haven't caught up with you in a while on that, so. Okay. Any questions on any of these budget adjustments? Well, that was a fine discussion. Mr. Clerk, what's next?
Next item E, such other matters as may properly be submitted before the
Does
committee.
anybody in the sound of my voice have some such other matters? Anybody? Commissioner Anderson?
I just wonder if Mr. Brooks, any update on the Veterans Director?
The veterans what, sir?
And I don't know if the Veterans.
Oh, yeah.
Veterans Director, I'm sorry, and I would assume this is an appointment by the executive, the Senior Services Director. I think we have a temporary right now, and the lady that was just sitting up here, I would vote for her if I had a vote.
Dave Brooks, Director of Health, Veterans, Community Wellness. I'll take those in reverse order. I don't have any update on the senior services. I'm not directly involved in that process, so I actually don't know where that's at. But I do agree that Joan is doing a wonderful job. On the Veterans Director, yes, we do have an appointment. Kwesi Batsari, we will start next Monday. We'll bring him to the next meeting 2 weeks from now to introduce him. That was our hope. And let you all introduced, get to meet him, as well as give a few updates. Although he may not give the updates, I may give the updates then, since he'll be brand new. And I think Andy, although he stepped out, Andy was here. Andy is sending around the announcement. If he didn't already, he will be sending around. Actually, he sent it to me yesterday, the one I had sent out a couple of days ago to the executive team, and asked him to forward it to the commission. And he double-checked it with me yesterday, and I said yes, so I think he's getting to that. So you'll see the formal announcement probably today or tomorrow.
All right, great.
Yep.
Thank you. Thank you.
Thank you, and since we're under some such other matters and you've raised it, I'd like to ask Commission Counsel, is that an appointment that will come to the Commission for approval? Or should come to the Commission for approval, or we have rules that says it comes to the Commission for approval? Can you clarify, please, Counselor?
Through the chair, so yes, it should come here, but as you know, historically, the administration has disagreed that their appointments require, and they have not been consistent with regards to what appointments they determine to send, but more than willing to have that further discussion if this body decides to actually take action on it, because I've talked about it for years, how they just simply don't comply, and there's no authority for them to do so, but we disagree on the subject.
That's one of the items that all we have to do is just pull your string on it.
Yeah, we'll just.
For years, the same answer comes out. Thank you. Commissioner Baker McCormick.
Just, is there any update on the location of the offices, the veteran offices?
I'll give that now. I was going to give that in a couple weeks, but I'll give that now. We are, if you'll recall, we had a 5-year lease for the current space, which is on Adams and Woodward. We extended it for up to a year, no less than 6 months, up to a year. You approved that a number of months ago. We extended it purposely to give us flexibility to evaluate other options, thinking that was not probably long-term an ideal option. We've done that evaluation. At this point, unfortunately, in the near term, the next few years, I've personally made contacts with the Federal Veterans Office in the McNamara Building and the VA Medical Center over at the Detroit Medical Center area. And although both organizations feel it would be a great kind of win-win fit if we could have our main Veteran Services Office, the County Main Veteran Services Office, somehow commingled in their areas to one-stop shop for the veteran in need. Neither has space available at this time. Both of them are hoping in a few years to have some space changes happen. The VA is looking to build a small addition, so unfortunately that's not going to be available in the short term. Because of that, we have evaluated other options and will be bringing forward at some point to this a committee for approval, probably in another couple months, a proposal to move the location of the central office for Veteran Services from the building on Adams to our building at 400 Monroe. Figuring we already have other county services there, particularly the treasurer, but some other services as well. So there sometimes is a need for the public to access that building. It's a lot easier to explain where it is. It's above Fishbones. Everybody knows where Fishbones is, but it's in Greektown. There's a little bit better parking, a little bit better transit for people who might avail that, at least compared to the Adams location. And we're going to look to exercise a reasonably short-term lease, 3, maybe 5 years, no longer, so that if and when we can get space available, again, either in the VA Medical Center or at the federal building, the VA services, that we would be able to take advantage of it then. So that'll be coming forward here. Remember, I'm being real clear based on the previous couple meetings we've had, both here as well as the special task force, that's for the central office for veterans. As our new director gets on board and gets oriented, one of the first items on his priority list, along with the staff, is going to be to start figuring out how do we create some model of satellite offices throughout the community. They may not be full-time, but they'll be available and publicized so that veterans out in various communities will have some local options if they can't get down to the main office, which we know, even if it moves to the Monroe building, assuming you approve that when we bring forward that proposal, is good but not ideal for every veteran.
And another question I had, I don't know if we talked about this before, but any marketing promotions, or how are we getting the word out? And is that something that you're having the new guy on board come up with a marketing plan.
Right, a communication plan, absolutely. That'll be also up on the top tier. We've talked about this at that last special task force, that there's a handful of items that we were going to address while we were in this interim period without a director. For instance, the space issue, but there are a few issues we're just going to have to wait till we get a new leader on board, get that person oriented, and move, and that's one of those. Part of it is we've got to get the operations working smoother. There's an old cliche, you don't sell it if it don't work. And I'm afraid right now, not every veteran coming to us is treated the way we want them to be treated. So I'd rather not start attracting more veterans to come to us until we're confident we can handle them the way we as a county leadership team, commission, executive team, want them handled. So there's a little bit of timing to that, if that makes sense.
Thank you.
And I would recommend that, not immediately, but within a reasonable period of time, with the new director coming on, that you walk them around the 7th floor. I think commissioners would want to meet them and also have these kind of discussions about that. There's always great interest on the commission.
Be great.
By the way, who got the naming rights over at that VA hospital?
The Dingle VA Hospital is the one you're talking
that
about?
one.
Yeah.
I believe there's somebody in the county that might be in Congress that also has that last name. That might be helpful in terms of if that's really the place. And it makes a lot of sense for veterans.
Right.
That there might be some help out of that office to
Right.
make something happen.
Agreed. Right now, they've been very cooperative. They are out of space. They're bringing forward a proposal to the federal government, so it makes our processes look very, very timely here at the county for approval to build an addition and with it move around some space. They're estimating that to take 3 to 4 years in federal timing.
Commissioner Anderson?
To the point that was brought up about the satellite locations, and I understand the new director's got to get in place and do an assessment of the need, but I would ask again that he reach out to us and for suggestions in our areas that we represent. See if there's not. I mean, I think at least a couple of places in my district that we could probably see some free space given to for the benefit of our veterans.
Be great.
Yeah,
we'll do that.
Thank you.
Yeah, I'll just hazard the guess that with 15 commissioners, we'll come up with 45 places for you, real easy, where that should be done. Or we have a death match in this room and have 1 or 2 satellite locations emerge out of that. But sounds good. Any other some such matters? Where are we at on the agenda, Mr. Clerk?
Item F, public comments.
Any member of the public wish to address the Health and Human Services Committee? Any member of the public? One last time, any member of the public. Hearing none, Mr. Clerk?
Item G, adjournment.
Without objection, we stand adjourned. Thank you, everybody. Coming off below as being the moderator.
Yeah, I check it every once in a while.
Of a big fancy Mackinac Island.
Since the session was at 7:30 a.m., I didn't notice.
7:45.
7:45. I didn't. Right?
Well, I was interested in the comment. I forget who it was that was on your panel saying there was
The federally
no
qualified healthcare clinic.
panels,
Right.
no
Yeah,
nothing
because you
health
said
care up there this
Detroiters
year.
can use.
And so when people said, "Hey, what about it?"
Do you
They said,
have
"Okay, we'll
anything
find a
from,
7:45 a.m.
It's all
slot."
just
I know
part of
that,
the,
right.
the
To
clinic,
talk population
And
health.
everybody sleeps through it. I think they're
Okay,
just
no,
coming
I just
back
had
from
a
the
brain
peak
fart.
holiday.
Yeah, did they send you like their brochure or anything?
It's amazing.
No, I don't have any.
Anything about the FQHC?
That's
How
what I
much
want
data
Okay,
gathering
okay.
is going on
because I
out
want
there?
to make sure I can at
Seems
least
to be an
provide
industry
that.
all of its own.
So if you can
Wayne
email
Healthy
me-
Communities.
Okay, is that what it is? Wayne
Yeah.
Healthy.
Wayne Healthy Communities. And I will,
telling me.
Healthy Communities.
Yeah.
If you could get that
Yeah. Couple
to
of
me
showers.
as soon as possible,
Yeah.
that would be great. Because I want to put it in a newsletter. And then the senior
Oh, is that right?
programs.
Oh, is that right? Well, Andy sent it to me
in
yesterday.
Detroit.
Just that basically.
Okay.
We have
Is it okay if I just share this? 'Cause he was
any concise information
I do
other
not.
than DAAA
Yeah, that I
Yeah,
don't.
Dix, I wasn't a liar.
Yeah, that I would be hunting and pecking on the internet just like you. I really don't.
Seems like we should have more than just
I know your boss. She's
that
great.
for.
We have learned a lot from her.
Right.
Well, nonetheless, we do
But
have
that's
to
all
do
we
that.
fund really for seniors.
You know, I really don't know. That is not even
Your
part of
baby.
anything.
Okay.
Sorry,
All right.
so I don't want to miss.
Yep, no problem.
But yeah,
That's
I
all
will.
know of.
Yeah, I will talk to
Okay.
the program. The
And
managers.
it's called Wayne Healthy
Yeah, Wayne Healthy Communities.
Communities.
Yeah, the FQHC actually has their own name because
Okay.
that money comes from HRSA.
Okay.
But they might even have something, you know, a format for you to be able to just plop in your newsletter.
Great. Great.
Okay.
Thank you.
You're welcome.
But we don't know her concerns with the audit yet.
Yeah,
If you
just had a
excuse
quick
just a second,
question.
yeah.
Do we have, other than the AAA, we have any other resources in Detroit?
Not as a publicly funded body.
Elementary or middle?
Somebody on council, I believe, has a senior task force.
That would have been Brenda Jones.
And there would be
There was a guy named.
probably some nonprofits that have gotten grants for one way or another, but
Reach out
no,
to her.
when you're talking though, who's getting funding
35 years ago. Middle.
from the feds, no, it's DAAA.
Okay, thank you.
He makes me carry in my pocket. You got yours? He makes me carry this dog. It's only because I've known him for 14
So one of those ladies on there, we call it never be.
Well, you have one too. You got one too. That's amazing. Yeah, he went to middle school with you.
So all
And
those
there
young
still are.
that young
Who was that one lady that called our
their
attention to,
foundation, they started practicing.
Oh, is that right? I thought there was, when you said it, I
Still
remember
out
the
there,
connection
but-
somehow to Henry, but I didn't, okay.
Yeah.
Oh, yeah.
go back and
I
listen.
tell them, so that's
Detroit.
Isn't it?
Yeah, 4 million people, and that, if you get to a certain age, you kind of, 1 degree of separation.
Exactly.
Sometimes not
Because I
even 1 degree.
believe
Yeah.
Well, I went to school.
Henry McClendon and I were in middle school together.
Oh, someone else you know.
Yeah. Oh, thank you. Yeah.
All right.
That's amazing, isn't it?
Okay, yeah.
That's
So
amazing.
thank you for that.
Yeah.
And I'll let Alice know that we talked.
Yeah, tell Alice I said hi, although I see her a couple weeks or something.
Okay.
Like I said, she's trained me.
But anyway, we're in
There's a
it.
couple of us.
Yeah, I'll bet.
Yeah, well, maybe we should start preparing for that because we're having the same difficulties or even more.
So listen, our
Trying to run
annual
around.
breakfast is that same.
Well, but these are the things like Aramark, right? Now we see how different it
Celebrating
is.
40, actually going to 40,
Prisons on
it's
Aramark out
it's 40, so it's really significant. And that's why other than that, we, you know, if it starts at 8:30, staff, we got.
Right,
Well, if you can support strip the assets and sell it off. At rock bottom.
Just want me to let you know.
Oh,
That's why. Yeah, that's why.
Well,
I
and,
appreciate that.
yeah, nationwide.
I thought he was still standing.
And
The world go round, so.
if your way of doing that is to have the book so muddled, nobody can figure out.
See you, buddy.
All right, the big D, take care. You know, your books are so muddled that you can't really figure out what the actual profit and loss is. Yeah, I think we need to put a stop to it. Well, and I think also there's some democracy if there's a majority. Got to go back and take a look at that vote on the Yeah, I hope I'm not living revisionist.
Yeah.
I'm pretty sure I voted no on that, you know. Now this whole thing about their committee. Well, they just never, nothing ever came to fruition. And I think it was Crane. Article is light on a guy. Sales pitches on these stadiums all across the country. Oh, they're a revival. Oh, they're a jobs. Oh, they're a, and it almost never pans out. And my kind of feeling now is approval for the public money. And by the way, close down the Wayne County Jail project. Price tag went from 300 to 400 million, more or less.
More or less.
I've been telling people this. Up the other day, final price of the hockey arena, 100 and some million. Go back to the original newspaper articles when it was announced, it was going to cost 145 million. So they missed it by 100%. But they're so much better than the public, right, that missed it by a third. No, it's not fun.
No, but the way you.
Yeah, juxtapose it, right?
Yeah.
It's like, are you kidding me? And so if we gave them tax breaks, the city, county had to sign off on that. Now, I look at that as a contract. We performed our end. You didn't perform your end. We want the money back. Broke the contract, there is no contract. We're going back to what it was originally. Pay your fucking taxes. To me, that makes enormous sense. As a business proposition, all you business people out there, that's what a business contract is. What you perform, what we're going to perform. Sacred oath when you do that. And live up to your end, well, you violated the contract. So we want back what we promised and delivered. Oh boy. It all discussed appointments and what comes here for approval and whether she wants to step into that. How ironclad is it in your mind? State law says, well, look at you. Because that's the job of court counsel. Go down there and muddle things. Keep it muddled enough they'll forget about it and just move on. Yes.
This is.
And we're a charter county,
Yes.
from what I checked, yeah. Highlighted the veto section. Okay, wait. I'm stepping into the middle of the stream when it says E.
So 8.
8,
Start with 8.
the county executive. The other responsibilities. Yeah. Except for elected officials, they can appoint, supervise, and at the pleasure heads of departments and all boards and commissions. Yeah.
A different state law for every board.
Well,
commission.
okay,
So,
sure, he
but-
appoints his. Whoa, 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 slow down, slow down. You're juxtaposing that with division?
That's for the people we put.
See, this is where the sharks, this is where you need to be smart. All we need is another sentence at the end of E. Says division heads must be approved by commission. Wow, I thought I had a great idea, council, and you were just like, bam!
No, because. and I-
Lousy idea.
And let me tell you what, because they do this all the time when they deal with the board. They always do this, well, it doesn't say X. Let me tell you. It says if law touches on the subject matter, that was intentional. Other stuff in
Oh,
there.
okay.
That was all they wanted
Yeah,
to
yeah.
do. So otherwise, because this is the example I was telling another commissioner.
Right.
They'll come along and say, but it doesn't say I can't do 500,000.
I can't do what?
500,000. See, we say you may do 50. We say, well, it doesn't say he can't do $1 million. We don't get to, we can't.
No,
It's
I'm
not
with
the
you.
authority.
No, it was immediately obvious to me the first time you said it.
Yeah, they do that.
Well, and the more you're around this stuff, and I wonder sometimes people are really around this stuff, but the more you're around this stuff, the more ambiguities that you see, kinds of laws that get passed, right? And so the courts quite rightly would go, there's ambiguities all over this law. If you didn't put it in there, there's so many things that are not in the law.
Right.
So, and you guys are all running to us to figure this out. So here's the deal. If it ain't in there, it ain't in there.